Good afternoon and good morning to some of you. I am Ablo. I am Executive Director of External Relations at the Tony Blair Institute. And alongside this stellar panel, I want to welcome you to this event today. And because this is virtual, I thought it would be good to let you know who your fellow guests are before I introduce the panel. In this virtual room, there's about more than 200 of us gathered here today to hear from the panel about 1 year on in Africa. And the guests together, we're made up of government representatives across Africa, of donor institutions such as the World Bank, the African Development Bank, of people involved in epidemiology and virology, of people involved in industry, philanthropists, and of course, academia. So it's an interdisciplinary group who've come here together to hear the insights and the recommendations of this stellar panel. We're going to have this conversation really in two parts. The first part is I'll be putting some questions to the panel. And hopefully, if we have time and the panel are able to be brief, they can also comment on each other's responses and get into a bit of a dialogue. The second part of today is to hear from you, the guests who've joined us today. We'll hear from you in the Q&A if you can type in your questions there. We've also had some early questions from those who are eager to let us know what they wanted the panel to answer. So really it will be in two parts. That is pretty much all of the housekeeping I'm going to do. We are all used to these Zoom events by now. So we're going to be talking about COVID in Africa 1 year on. And a pandemic presents both personal and national challenges. Personal challenges such as how do I and my family stay safe? I mean, the questions that we ask are now, when will I get offered the vaccine? And by the way, I have not been offered the vaccine yet, and I'm resident in the UK. There are also national challenges. Government leaders have been faced with very tough decisions to make around public health and the economy. And so these national challenges are some of what we'll talk about here today. I'm from Ghana originally, and I'm currently resident in the UK. And every time I hear from my family, what I'm aware of is the differences in context between, for example, Ghana and the UK, where I am now. So just to give you an example, Ghana has a population of about 30 million people, a younger population than the UK. The UK has a population of about 70 million people. The UK has achieved a vaccination of first dose to 30 million people, the entire population of Ghana equivalent. In Ghana, however, we have just under 1 million vaccines that have actually arrived in Accra. So those are disparities. And I'm not saying this to shame one country or another, but to say finally, it is personal, it is national, and it's about international cooperation. So I hope this panel today will also talk about what is needed from an international cooperation standpoint to achieve some equity across countries such as Ghana and the UK. So, Tony, I want to go to first. Tony Blair is the executive chairman of the Tony Blair Institute for Global Change and the former Prime Minister of the United Kingdom. It'd be good to hear some opening remarks from you, Tony.
Yep. First of all, welcome everyone, and thank you so much for taking place. Thank you so much to President Kagame, to Dr. Ngozi, Dr. John for being here with me. I'm really, really grateful to you. I know you're all incredibly busy, so to give up your time for this session for the Institute is remarkable, and I'm most grateful. And you, Awa, you don't get sympathy for not having the vaccines because you're so young. So this is the only time in my life I've ever been glad to be getting older. Your cue in the vaccine rollout, but it's a really important topic. A year on, I think there are a lot of lessons, but also there are a lot of urgent actions we need to be taking very soon. So, Awa, back to you to start the questions. And again, to everyone, thank you so much for coming, and I'm sure we'll have a fascinating discussion.
Thank you very much, Tony. So as I said, national and international challenges exist. And to tackle the national and international, we have to work together in cooperation. And what will it take? It will take great leadership. and influence to do that. So we have here the kinds of leaders with the kind of influence that can drive this forward and in a positive direction. We have His Excellency President Kagame of Rwanda, whose government TBI has worked with for over 10 years. We have Dr. Ngozi Okonjo-Iweala, Director General of the WTO, very recently, the 7th, I believe. We have Dr. Tony Gengasong, Director General of the Africa Center for Disease Control, who TBI also supports. So I'm going to address my first question to President Kagame. Now, Rwanda is lauded as one of the most effective governments in its response to COVID, not just on the African continent, but globally. The recent vaccines rollout that we were just talking about before the panel opened is just one example of this. However, vaccine equity is an issue across African countries. It'd be good to hear from you what you think is needed to address vaccine equity on the continent. And then also, because of those broader challenges on the economy, it would be good to hear from you, what has the impact been on Rwanda, and what are the broader key issues for the country and the continent going forward? Thank you very much, President Kagame. Over to you.
Well, thank you. First, I thank Tony Blair for convening us. I'm honored to be here today with Dr. Ngozi and Dr. Nkengasong. By the way, I want to congratulate both of you. Ngozi as the first African to lead the WTO. It took a bit longer than we expected, but the result was never in doubt. So congratulations.
Thank you. Thank you, Your Excellency.
And John, congratulations on your recent reappointment to lead the African CDC for 4 more years, and looking forward to working with you and giving you every support we can for the success of your mission. I would say the COVID-19 pandemic magnified some institutional weaknesses across Africa, but it also uncovered some hidden strengths which we can build on. One of the big gaps is that Africa does not produce, I think it has been said many times, significant quantities of medical supplies. We have been completely dependent on external sources for tests, therapeutics, PPE, and now vaccines. So on your question about vaccine equity, the real solution is to prioritize manufacturing in Africa. The new continental free trade area, African, makes this even more attractive for investors. One of the hidden strengths that has made a big difference over the past year is the effectiveness of Africa's continental institutions. African CDC played a major role in coordinating supply deliveries for every country, and the African Union's special envoys, including Ngozi, successfully pushed for a debt service suspension for Africa. Therefore, there is no doubt that the pandemic has set the whole world back in terms of development progress, including Rwanda and inevitably the wider African continent. But the fundamentals that were driving Africa's strong growth before the pandemic, such as urbanization, digitization, or tourism, and so on and so forth, are just as relevant today as they were before. But you can't go back to business as usual either. If we don't use this opportunity to really strengthen our health and education systems, it would be a big loss. So we've been trying in our own settings in Rwanda, within our own limitations. We've set up an economic recovery fund to try and help businesses recover and move on as we battle the pandemic. So far, so good. We still have to identify the sources of these resources. So from that, I think we can continue to put our resources together on the continent and see how we move forward without leaving anyone behind. Thank you very much.
Thank you very much, Your Excellency. And you refer to the Africa Continental Free Trade Area. And so I think it's natural that I go next to Dr. Ngozi. Dr. Ngozi, your confirmation as Director General has been heralded as the right person at the right time. And I think one of the media that you did before confirmation was that this is not time for business as usual. This is a phrase that His Excellency has just also expressed. You have stressed the need to keep global trade flows open, not just for the movement of supplies of vaccines, therapeutics, PPE, diagnostics, but also to help with the recovery that is required for the economies and for the growth that the African continent was seeing in their economies prior to COVID. So what are your top priorities to achieve that remaining open for global trade, the continent remaining open for global trade? And could you also speak to a little bit the particular issue around medical supplies and the trade issues that you've already been speaking to? And this morning I saw some coverage of you talking about TRIPS waivers. It'd be good to hear from you on that as well. So over to you, Dr. Ngozi.
Well, thank you, Ablo, for that. And let me also thank Tony for the invitation. It's great to see you again, and congrats on the Tony Blair Institute. It's absolutely a delight to see His Excellency Paul Kagame. Always great to listen to him. And John, congratulations. Well, you've asked a series of very important questions about the linkage of how Africa should recover from the growth and what is the top priority for me on that. Like I've said before, I think the topmost priority to return to sustained growth, the biggest fiscal stimulus you can have is access to vaccines for everyone. So the inequity that we're seeing now in access to vaccines is quite disturbing. The fact that maybe more than 80% of doses administered in the world today has been done in 10 countries, at least in the richest countries and the upper middle income countries. 10 countries have administered almost 80% of doses. And there are many, many countries who've not even administered one, including on our continent. So that kind of inequity is not acceptable. And I strongly believe that we won't be able to really recover until we take care of the health aspects of the pandemic. That's why I keep saying that the biggest economic stimulus is access to vaccines for everyone. Now, how can this happen? Trade has a strong role to play. Trade has played, as we showed yesterday when we released the global trade forecast, that trade has done much better, grown by 8% this year after contracting by 5% last year. and we're expecting 4% growth next year. But of course, growth in Africa and Latin America is lagging behind that of other regions. This growth has kept supplies moving of diagnostics, of therapeutics, such as they are, and of vaccines, the little we've seen. But it's definitely not enough. And I want to come back to what His Excellency said about the availability of vaccines. What we're finding is that there's a big supply constraint all over the world. There's supply scarcity. And when there's scarcity, behavior is not always good. So with the supply scarcity, some rich countries have also been bidding up and diverting supplies from COVAX, which was built to try and distribute doses to poor countries. Some rich countries are not exporting, even though they are producing. And the distribution of manufacturing capacity over the world is very uneven. So this is where I believe two things or three things to approach this vaccine. First, trade and the WTO can contribute more by lowering export restrictions. The supply chain for vaccines is very intricate. And I'll just quote the one that Pfizer-BioNTech representative told us 2 weeks ago. Their vaccine needs 280 components, which is manufactured in 19 countries. So it's a very complicated supply chain. When there's a restriction on any part of that chain, it disturbs production. So WTO members should lower restrictions to allow a free flow in the short term and medium term. And I'm glad to say we had 90 countries with restrictions. We are down to 59, but I think we could still do better. Second, the fact that manufacturing of vaccines is concentrated in various parts of the world and manufacturing capacity is not distributed well is part of the problem we have now. And we need to change that. So when His Excellency talked about Africa having to import much of its pharmaceuticals, up to 90%, according to the Economic Commission for Africa, having capacity to manufacture vaccines is very important. That's one of the things I'm pushing at the WTO. In fact, in 2 weeks, we've called a meeting of the vaccine manufacturers precisely to talk to them about how they partner with us on the continent and in other low-income and emerging market countries to boost capacity. There are countries that it may not be perfect, but they have some existing capacity that can be turned around in the medium term, 5 to 6 months. And beyond that, we need investment on the continent and in order to manufacture. In fact, we need investment in the pharmaceutical industry. And with the African Continental Free Trade Area, this is one way in which we can add value on the continent. We can create employment. 2 or 3 countries or more, as many as possible, can develop capacity to manufacture not only vaccines, but all the other diagnostics and therapeutics for the continent, and we can trade them. So the third aspect you asked me about TRIPS, is the fact that we have over 100 countries, members of the WTO, who have asked for a waiver of the intellectual property rights so that they can get access to what is needed to manufacture vaccines and therapeutics, etc. And of course, the history of this comes not only from what we are seeing now, but what happened to us during the HIV/AIDS epidemic, where we had to wait 10 years to get access to drugs. H1N1, when that happened, the epidemic, rich countries bought up all the vaccines and poor countries had none. Now we see it. So countries are saying we want access. We want the intellectual property. And I think we need to discuss that issue and find out how we can get access. One thing I would add is that I feel we can do that while still incentivizing research and development. And we just need to come together and have a pragmatic approach at the WTO that assures us almost automaticity of access to know-how and technology to manufacture. And we can do it while still letting those who are investing in research and development know that we are not against that. So that is what I think we should shoot for the longer term, so that next time we will not have this argument. We will automatically be able to access. So that is what I have to say about this whole set of issues. And I believe that for us to recover, we need to take care of the health problem, and then we need to add value to our products on the continent. Africa is 3%, 2 to 3% of external trade, and that has stagnated for years. If we want to create more jobs, export more, trade with each other more, we need to add value to all our primary products. Let me stop it there.
Thank you. Thank you very much. I like the biggest fiscal stimulus is access to vaccines. I think that's a very clear way forward. And I think some of what you've mentioned is about planning better for the future, increasing local manufacturing capacity on the continent and knowledge transfer, for example, whether it be by TRIPS waiver or other methods. Some of these are exactly the issues that Dr. John Gengasong has been focused on with his Africa CDC team. So I'll come next to you, Dr. Gengasong. So Africa CDC has shown real leadership in the COVID response, and of the global health institutions demonstrates what President Kagame said at the outset, is that COVID has actually shown the strength of some of our continental institutions who have really had an impact to help governments tackle COVID. So Africa CDC is one of those. It's shown real African leadership. And you yourself have also written in various scientific journals about what we need to do going forward to build back better, to use that phrase. You talk about how Africa needs a new public health order. I'd like you to explain to us what you mean by a new public health order in order to tackle and address these pandemic threats that will always come along. We know that there will be another one. So what do you mean by that, and what are the most critical components?
No, thank you, Awo, for that kind introduction. And let me first of all start by thanking the Tony Blair Institute for the remarkable collaboration and support with Africa CDC. When I come to addressing the topic of what we're referring to as a new public health order, we'll touch on what I always characterize as trusted partnership, and the relationship between and the collaboration between the Africa CDC and the TBI has been part of that trusted partnership, which I will expand on later. I would like to thank Excellency Kagame for all the support for Africa CDC all along, and for me personally in this extremely challenging task that we are trying to raise a new institution and respond to a pandemic of this size. I think the COVID-19 pandemic made us graduate from children to adults within 1 year. So we had no choice but to jump into the swimming pool and start swimming. And of course, my sister Ngozi for all the support. We have learned a lot from the Ngozi, the Stripes, the donor Kaburuka, all the economic terms that I've never I thought I would come to know in my public health life, but because we talk all the time and coordinate our efforts all the time. For me, the COVID-19 pandemic on the continent, and it's hard to say anything useful after President Kagame and Dr. Ngozi have already covered grounds, but let me share 3 lessons that I have personally learned from the COVID-19 in my 30 years experience in public health. One is that we used to talk about the connectivity, but the extraordinary shared connectivity that we see as human beings is remarkable. That just 1 year ago, a virus that started in a place called Wuhan, which we probably got up that morning and heard about it, researched Google to find out. Suddenly it was within 1 year, it's all over and killing 2.7 million people. The second is our shared vulnerability. Whether you live in the global north or you live in the global south, I think this pandemic has actually flattened the curve. I think we talk of trying to flatten the epidemic curve, but this pandemic has flattened and leveled to all of us, that we realized how vulnerable we are as a people. And lastly, the shared inequities that we all have seen either within a country or between countries and between regions. I think the vaccine situation is a very good example of the shared inequities that exist, which we must seek to address. So if you ask me 1 year into this pandemic, what have you learned? I think those will be the 3 big lessons. But on the continent of Africa, I think I would to your question of what do we mean by a new public health order? It's clearly 5 things that we believe that we have to do as a continent to strengthen our health defenses. And some of those have been elaborated by President Kagame and Dr. Ngozi. First of all is local manufacturing or regional manufacturing on the continent. Some of the data has been thrown out here. Vaccines, we import 99% of our vaccines. We produce no diagnostics. I mean, I've worked in HIV/AIDS for 32 years, and for 40 years of existence of HIV/AIDS, we conduct about 100 million HIV tests a year in Africa, and no single rapid test. I mean, a single strip of tests is produced in Africa. So that has to change if we have to ensure our own safety and health security. Imagine that when COVID hit the continent, we had to scramble and organize ourselves in a way that I had to send somebody to go to Germany, bring the first test in a suitcase back to Addis Ababa. Then we started organizing trainings in Dakar and South Africa. And all we had at that time, we did what we call training packages, where everyone who attended the training in Dakar or South Africa went home with 100 tests. 100. At that time, it was gold to have 100 tests. So a continent of 1.2 billion people cannot build their health defenses on such a manner. And of course, therapeutics. I think that is one pillar of our new public health order, that we must be very deliberate in this. Second is strengthening our own national public health institutions and agencies like the Africa CDC. We have to begin to think of regionalizing the public health security architectures of the world. We cannot use a central model to respond to pandemics and outbreaks the way it is now. So investing in institutions like the Africa CDC and then national public health institutions in each member state will constitute that network of security apparatus for health security apparatus for our continent. We have seen during this pandemic the extraordinary leadership of our continental presidents, where the President Kagame and others have met with Africa CDC about 14 times to discuss this pandemic and seek solutions together and chart a common way forward. I think that is what I mean by regionalizing our health security institutions for the continent. Thirdly is workforce development. We currently need about 6,000 epidemiologists on the continent. We only have 1,900. Okay, that is a gap there of about 4,000 that we need to train, and train in a very deliberate manner. Train it as if we were building a cohort of army to go to war, because we are at war with these pandemics. I mean, all the time. As we speak, we have 2 Ebola outbreaks going on, one in DRC, one in Guinea, and then we have a pandemic on top of that. So I think it's very clear that we have signals that we are living in an era of pandemics. So I think investing in our workforce deliberately, both at a national level, but also a community, investing in a community workforce development is going to be critical in protecting all of us. Fourthly is domestic financing. We cannot continue to just rely on support from outside the continent. And I think President Kagame has been leading the effort for domestic financing, which is extremely fundamental. We will not meet all the things I've listed above without that strong domestic investment in our own resources that will complement what our partners are allocating. That is the banks or other bilateral initiatives. I think that is extremely valuable. And lastly, trusted partnerships. We need to look at partnerships and reflect as to how those partnerships are supporting our continental agenda. And we should be on the driver's seat to define where we are heading in the context of Agenda 2063. Each partner that comes to us, Africa CDC, and say, look, we know where you're heading with your strategic plan. We know where you're heading with the Agenda 2063. We want to work with you to fulfill that, accord that partner a trusted partner, because they are aligning their vision to our vision. So I think those are the 5 elements that we are really championing as Africa CDC to really build back better, build back bolder, and build back bigger. Thank you.
Thank you very much, Dr. Gengasong. So Tony, I'm going to come to you. You've pivoted your institute 12 months ago to entirely focus on helping governments and leaders respond to the COVID-19 pandemic. That was 12 months ago. Looking ahead 12 months, and also speaking daily with the presidents and leaders that we work with, what do you think are the most critical factors? And also, having heard from the panel, areas of agreement and areas to add. Tony, over to you.
Yeah, well, first of all, a real thanks again to the panel. I mean, these were 3 really great contributions, and they each dealt with different aspects of this. And particularly, let me say, a big thank you to President Kagame for really setting, Rwanda on such a strong path in dealing with COVID. And of course, Ngozi and John are now there for several years leading their organizations. I reckon they've got 2 of the toughest jobs in the world right now. So thanks to both of them. So here's my take on where we are. I think at the very beginning of this, if we'd said, okay, in a year's time, we're going to have a get together and see where we go, I think we would have hoped at the outset that we would be very much looking forward to the future, having come through the pandemic. And the reality is we're still in it. I think a lot of Africa, having got through that first wave, is now in a second wave that's very tough with the new variants, and COVID hasn't gone away. On the contrary, it's still in many parts of the continent and indeed the world rising. So that's the first thing. I think the second thing is we have now learned to Dr. John's point about shared connectivity and vulnerability, is COVID anywhere is potentially COVID everywhere. So this is a thing in which the world is in it together. But then when it comes to how we're dealing with it, there's a massive disparity, because Africa is without substantial amounts of vaccine and struggling, at least in the first half of the year, to get that vaccine. And yet it's the rest of the world which is getting vaccine and will, in the months to come, have more vaccine than individual countries need. The world has a massive interest in ensuring that Africa has access to vaccine, because COVID anywhere is COVID everywhere potentially. And therefore, I think what this really comes to is 2 things. It's first of all, what's necessary for the immediate, and then what's necessary for the longer term. For the immediate, we need to free up those vaccine supplies. We need a much more rounded, intelligent, enlightened self-interest approach from the countries manufacturing vaccine and with vaccine. We need to make sure not just that vaccine, but other diagnostics, rapid tests, for example, therapeutics and antivirals reach the continent as well. And all of that has got to be speeded up. I mean, I personally would like to see a situation where by the end of this year, Africa is substantially vaccinated. I think that is possible given the large amounts of vaccine that have come on stream. You've got, of course, companies like Pfizer and Moderna, AstraZeneca, Sinopharm, Sputnik already manufacturing vaccine, but then you've got Johnson & Johnson, Novavax, other companies that are going to be manufacturing substantial amounts of vaccine coming on stream soon. But we need to make sure that, for example, those manufacturing facilities in the West are still running at full tilt, even after the countries in which they're situated have themselves been vaccinated. And I think, that ambition for the immediate is very, very important. But then I think the second point, which is made by President Kagame and indeed Dr. Ngozi, Dr. John, it's clear and obvious that Africa has got to look to the future in circumstances where there will be significant vaccine manufacturing capability, and not just manufacturing, by the way, diagnostic capability, surveillance, genomic sequencing capability. I think it's going to be absolutely essential that we have the highest quality data, surveillance and data gathering, because I think we will learn an enormous amount if we have the right data. And so I think that there's going to be a need for Africa to come together and say, okay, what are the partnerships that we require? What are the things we need to do to develop our own capability for the future? Because even aside from COVID, Africa is a major consumer of vaccine. But with what we now know about COVID and likely problems with pathogens in the future, this is absolutely a moment where it's right that the main institutions and countries of Africa come together and work with partners around the world in order to make sure this position is corrected for the future. And as you know, we're already, as an institute, in conversation with many of the leading pharma companies and seeing how we try and help facilitate some of those partnerships. So I think this is where we've got an immediate issue that we have to solve, and then we've got the long-term future to plan. But, as Dr. John said at the end there, bigger, bolder, better is absolutely where we need to be. I mean, I think the good news, as we can see from the panelists, is that energy and desire to take the right decisions is there on the continent.
Absolutely, and thank you, Tony. And I think the role of industry here in the pharma industry for this particular issue on medical supplies, vaccines, therapeutics, and diagnostics is absolutely key. And Dr. Ngozi mentioned the convening that's happening, I think you said in 2 weeks' time, really critical. And the mismatch of supply and demand on the continent, 1.2 billion people and 99% of supply from outside the continent is very stark. So there are many issues we could talk about here, but we can't ignore the priority around vaccination as in the immediate term. So I'm going to open for the second part, which is slightly truncated, but I think the time we've had from the excellent panel is still too brief to get some questions that were submitted earlier. So I'm going to come to Dr. Solomon, who is from the Gates Foundation, Deputy Director of Health, I believe. I think, Dr. Solomon, you have a question for His Excellency President Kagame. Please unmute and ask your question.
So thank you, Awo, and distinguished panelists. Greetings from South Africa. It is indeed a huge privilege to be attending this session. My question to you, His Excellency, would be, what do you think the role of the African Union Commission should be in pandemic preparedness to avoid future vulnerabilities that were identified during the current one? Thank you.
Well, thank you. The African Union Commission's major role in this would be one around the CDC. I think CDC has to be structured, strengthened to make sure that it has the autonomy and effectiveness it needs to be able to deliver, so that we don't have too many hands in this specialized institution, and that with all the sensitivities that go along with what it has to do. That is key. And the Commission has a big role to play in that, in ensuring that that autonomy and effectiveness is really there. The second, we keep talking about domestic health spending. First of all, this is possible, but it's only possible if we have that kind of mindset and understanding that African countries have many priorities. That's fine. But I think every one of us should be considering health spending from our resources as probably the number one priority, because if we got that right, then it enables us to deal with other priorities. We need health populations, we need health institutions to be able to do whatever else we need to do that is a priority. So the Commission has a role to play in making sure that our countries understand that need and single out specifically in our national budgets so much that we can afford to be put in health for the health, domestic health financing is key. So if the Commission worked with all of us and was able to, were able to achieve that, I think that that would have delivered the mandate of the African Union Commission. So I'm lucky, well, lucky to be able to voice what it needs to be. I have also been mandated by the African Union to champion this effort for domestic health financing. So the pandemic really makes it a priority, and we'll spend all the time working with the Commission, with the CDC, and I'm sure there are many ideas coming through these institutions that we can help crystallize and be able to move forward in a practical sense.
Thank you very much, Your Excellency, President Kagame. I'm going to take one more question, and this is a question from Dr. Chikwe of the Nigeria Center for Disease Control, because I think we've spoken about the international institutions, but the role, especially when you look at prevention, rather than, you know, control and response of national institutions on the continent is also worth a mention here. So over to you.
Thank you very much, Awan. It's a real privilege to be on the able to ask this question, to do three very distinguished colleagues I hold in very high esteem. Your Excellency, President Kagame, a quick question. Many years before the pandemic actually started, you set up the Biomedical Institute in Rwanda, pulling together a lot of the fragmented public health architecture in your country into one organization that can then do everything in a much more strategic way, from centralized strategic procurement to advice to implementation. We visited that institute 3 years ago, supported by the TBI, and a lot of the work we're doing at the Nigeria Center for Disease Control was really inspired by what we saw in Rwanda. Sir, do you think this is a model for the continent to pull together? Because for us to be able to engage in the ways every member of the panel has alluded to, we have to have the strategic strength within our countries to do so, and having every disease being managed by a single small disease control program is definitely not the way to go. Thank you very much, sir.
Well, to begin with, it worked for us, and I suspect it could work for other people as well. It helped us to rationalize, to optimize the resources we had. We don't have too much in terms of resources, but the little we have, we needed to manage it properly. And the way of centralizing some of these activities in a center like this, the biomedical center we set up with the help indeed of TBI, has shown that if you start with that and then do the right thing there, the results are good. There is no question about it. I don't see why it would not work in other places, but if other places have better ways of doing it, then we should know it and we should learn from it. I have no quarrel with that, but just to be precise, it worked very well. And so far, we want to learn from others where things have worked well or even better. We remain open. So I think we should consider this as one of the ways we could go forward.
Thank you very much. I think just Tony, and then I'll come to Dr. Ngozi and Dr. John. Tony, I mean, this is an important point that you've talked about quite a bit, which is the importance of strengthening surveillance at the national level. But if you have any final comment on some of these questions, that would be good. And then I'll go to Dr. Ngozi, Dr. John, and then we will wrap.
Yeah, no, I think, I mean, Chikwu, by the way, is doing great work in Nigeria on disease control there. I've got nothing to add to what President Kagame has just said on the center, but and the way to coordinate that in a country. But I did just want to say that I think the key thing, as well as dealing with this immediate issue of getting vaccine into Africa, the key thing is to be able to set out a coherent plan for the continent in which the different aspects of this, whether it's vaccine production, research and development, data and surveillance, genomic sequencing, trials, because we will need that as well, diagnostics, you know, the idea of setting out a plan for the continent in which the continent comes together. I think this is the central coordinating thing that has to be done. And the one thing that where I think we can take some heart from is that, you know, the African Continental Free Trade Agreement, I think I would be right in saying that when the move for that first began, people were pretty skeptical and were pretty skeptical as to whether they would get the sign up that they really needed. But actually it is in place and it is making a difference. And I think this concept of Africa coming together and coordinating its response to things in order to take its own destiny in its own hands, I think that idea has taken root now, and that gives me a fair degree of optimism that this plan can be for preparedness for the pandemic for the future, that plan can both be formulated and implemented.
Excellent. So a continental plan is key that takes all those things into consideration. Dr. Ngozi, you've talked about the role of trade, and you know the Africa Free Trade Area has 54 signatories, I believe. So that's I think the naysayers were wrong there. Is there any final thing you want to emphasize for the guests today and your fellow panelists?
Yeah, thank you, Awo, for that. I just want to build on what His Excellency has said and what Tony has also said, and add another element. We're doing a lot of work on preparedness now and lessons learned. Internationally, at least a lot of that is going on. And what is very, very clear is that financing surveillance and preparedness will be far cheaper for countries and for the world than response. And it's amazing how we are not prepared to invest billions in preparedness, including the disease surveillance, using strong institutions. President Kagame said centralizing some things work. And I think, yes, that is a very good model. You centralize some things. In a large country like Nigeria, you might also need to have strong regional centers. But all I'm trying to say is that surveillance and preparedness cost millions and billions, but response has cost the world trillions. The rich countries have spent 21% of their GDP, trillions of dollars on response and fiscal stimulus. Emerging markets, 6%, and low-income countries, 3%. So a vast disparity. Why don't we just now come together as an international community to finance preparedness, which will cost 1% or 2% of what we're spending on response? So that is the point I want to leave us with, that we're all in it together, and it's better for us to spend money now to prepare for the next pandemic, or even a continuation of this one, even the variants we're seeing, than to spend billions on response. And I think Africa should really think carefully about this. That's where places like the CDC, Africa CDC, even our own national CDC, where Dr. Hekwazu, Dr. Faisal, they're all doing a good job. we should be thinking about this. How do we prepare? Thank you.
Thank you very much. Now, I know this distinguished panel has other meetings and events to go to. I usually allow a 5-minute buffer. We're 5 minutes over. So Dr. John, I'm going to leave the last word with you. I think you've had a great deal of support for your plans going forward. Final word to you, and then I'll simply say thank you and goodbye.
I mean, thank you. I think you've heard from the panelists that, which I'm very grateful that Dr. Ngozi, Excellency Paul Kagame, and Honorable Tony Blair are all probably head experts. So I probably will leave you with that word that is needless for me to mess up with their brilliance in their submissions. There, I think Dr. Ngozi said it very rightly. So each time we go into DRC to support the country to respond to Ebola, we spend billions. And we could have used a fraction of that to support the country to establish similar institutions like the one Excellency Kagame mentioned, similar to the Nigeria CDC, which, by the way, Chikwe, your leadership in running Nigeria CDC and guiding the response in Nigeria has been extraordinary. I mean, I say that truly from my heart. You and I talk all the time, and I think I admire your courage in doing what you are doing in Nigeria. Those are kind of institutions that are going to lead us and frog leap the continent in our preparedness efforts. We currently have 15 national public health institutes. We need 55 on the continent that will network with Africa CDC to produce us that instruments for our health security going forward. Thank you again for the opportunity to be on this panel.
Wonderful. Thank you very much, Dr. John. So thank you very much, Dr. Ngozi, Dr. John, Tony, His Excellency Paul Kagame, and everyone who joined us for this session today. Hope you stay in touch with the Tony Blair Institute, and we'll have further events and convenings and hopefully talk to you about the progress these leaders are able to bring to the fore on COVID and the African continent's development. Thank you very much. Goodbye.